Hello, Danny. Lovely to see you. How are you today? Thank you for coming on.
I'm doing great today. Thank you very much, Grace, for having me.
It's a pleasure. It's a pleasure. So we all know that, even though we're both cancer survivors and everything, that doesn't stop us from our advocacy, right? We fight the good fight with all our might. But the whole essence is for the audience to know exactly how you have been able to go through your diagnosis and overcome. So I'm going to start with the very question that I ask all my guests when they come. When you received your diagnosis, what was your reaction?
Yeah, that's a great way to get into it because that was kind of my first entry in that step into that void. I'd say it was just aghast. I always look for a different word to use that's like just super dramatic and you're kind of going through your life. We both know and we're handling it. We're doing everything okay. And then wow, I would say my first initial thought was vacuum alone, very much alone, Grace. Just
Yeah.
terribly, terribly lost. And now in retrospect, I say things like, well, I should have known there was such a thing as bladder cancer, but I'm like, what is bladder cancer? So I'm sitting in a cubicle. If you want to put a vision to it or a time frame when I went to the doctor's office, I really knew that I had bladder cancer, besides taking out that tumor. I was sitting in a kind of a cubicle area waiting on my next appointment, feeling very lost, very depressed, like very much here's reality and wow, I got to face it. And a fellow had walked in over on the other side to make an appointment or show up for his appointment,
Hmm.
and he had missed it. And they had proceeded. It took me about a month to get into my appointment. I had cancer. I knew I had a tumor that whole time, and he started crying, and that was the first moment that I kind of knew that I was going to get into helping other people because I said, I'll have an appointment in a week, and he'll have to wait a month. I'm just going to give him mine. And that was my first
Oh, wow.
shining pinnacle of a moment. And of course I didn't. My wife would disagreed with that very much. I that was the one time self-advocacy, very important. That was my first lesson in self-advocacy.
Yes, I can imagine that, shock and frustration. You said you had a feeling, but the fact that it was now confirmed, because
Exactly.
sometimes we have those notions, but we feel, ah, no, it's probably just,
Yeah.
those
Yeah.
negative thoughts. But to have it
Mhm.
confirmed, I can imagine what you must have been through. So
Mhm.
what did your treatment for bladder cancer actually entail?
When we all, of course, if we're lucky enough to get a successful surgery, and it was mine was situated in my bladder, inside of it, over the left ureter from my kidney. It was over the hole from my kidney, so it wasn't emergent, but it was closing up that kidney a little bit, and it started with that surgery. They cut that out. I got a stent because we had to keep that flowing, and after did the initial surgery and stent, I was a candidate for BCG immunotherapy. So that enters, when you talk about realizations, Grace, and those times where we know and how we feel. Well, cancer, it comes with like one realization after another. I went through the surgery. I was like, wow, that's great. I have a what inside of me? Okay, that sounds fine. And then you get used to that. And then there's another thing, which is immunotherapy and cancer therapy, which I've been going through for 2 years now. I'm in a 3-year course of BCG immunotherapy, and I am responsive, and I haven't had any tumors. So I've gone through the whole process. Thank you very much. No
Mhm.
evidence of disease. That's why
Mhm.
we come to the game. You know what I mean? I do
Yes.
attribute that to a good physician
Hmm.
and a good diet and aligning yourself spiritually. Very important. I never knew these things. I just turned 50 in August, and I never really knew these things until I got cancer.
Absolutely. And during this time, I will go back to the immunotherapy part because that's something I'd like to highlight.
Mhm.
Um, I always talk about mental health,
Mhm.
because that was really crucial on my own cancer journey. What was the outlook? What was your support system like? I
Oh.
know you're a fabulous wife and family and community, but
Mhm.
from the onset, what was it like?
Yeah, that's an interesting intersection to be at, actually. Like you said, it's very well worded. I got of course, my wife and my community, but what did I have?
Yes.
And that's an interesting place, Grace. I'm gonna have to. That's a great question. But I think that represents that void, and then you have to let these people, like even you and I, Grace, at our in our career in cancer, as it were. We meet each other and we're receptive to each other. So hey, unfortunately, lately a lot of people get isolated when it comes out. So when you talk about psychological health and the entry That's one thing we got to give to ourselves is that, the first one's my wife. I've been married for 29 years now. And
Oh, wow.
our relationship, I knew I could use it to strengthen it, and I knew I could use it to destroy it. And luckily we strengthened it. But gosh, she's a strong woman. Anybody with
Amen.
cancer can relate to the psychological, I don't want to overstate it, but the psychological torture that you can go through when it comes to sitting in a room and thinking about the devil and the angel and really having to speak to them. That was not very settling with me, Grace. So yeah, I advocate for mental health consultation. I am not a mental health professional. I
Yes.
should have got one. I learned through practice and study. So I'm a little stubborn. I am still a man, unfortunately.
No, not at all. We all learn on this journey, right?
I
We've
learned a lot.
we've
Yes,
we've
ma'am.
all been changed, you know. Even our caregivers, like you spoke about your wife, you know, we
Hmm.
even sit in that chair in the infusion room worrying
Hmm.
about them. And that takes
Hmm.
that mental toll on us, you
Hmm.
understand? So,
Yes,
yes,
yes.
that intersection is very important. That was why
Yeah,
I asked because
yeah.
I have a couple of friends really right now who are undergoing that and no, it's hard, but I have to keep, telling them, listen, if you're not going to toughen yourself up, I swear to God, no amount of love will do that, only self-love.
Yeah.
With bladder cancer, because we all know where it's situated,
Mhm.
how do you try to change people's minds about talking about it?
Yeah, that was what became very important. Just getting that through to people that
Yes.
there's a shy away from. I think right when I walk up to somebody after all this
Mm-hmm.
time, and I say, "Well, I'm Dan." That's how I introduce myself. I'm Dan, and I've had non-muscle invasive bladder cancer. There's an unconscious link between that, just as you say, when it comes to just how we feel as human beings and the way we look at the genitalia and we look at things,
Yes.
sexual dysfunctions and such. These are very normal human things, and I've always been that way.
Yes.
It's like, hey, I'll be standing in a group, and I'm like, well, ain't nobody wants to talk about that. Well,
Mm-hmm.
no, we're going to force ourselves to talk about that. So I kind of ended up. I think we all end up with a direction in advocacy, and
Mm-hmm.
that became that some of the misconceptions. But it also in that it became very important from a male standpoint due to us having a tendency to not pay attention to our health and say, okay, there are precursors to bladder cancer that you might not want to talk about that could be the difference between life and death, like erectile dysfunction and men's prostate issues. Then I went through them and I totally denied them. I did not want to face them. And they could have been the difference between a bit better of a diagnosis. But in bladder cancer, if you wait, non-muscle invasive bladder cancer can turn into muscle invasive bladder cancer. It's a lot about time. So, blood in the urine is one of the first indicators, but it's not always that. I think we all, with cancer in general, we get back pain, we get fatigue, extreme fatigue. I had all those things, and I said, well, I'm just tired. I'm getting old. My prostate is old. These things happened to my father. And then when I started to see how scattered it was, the way that I thought, and about how when I'd say it to people, you'd see that flinch in their face to where they were like, that's cancer. We all get that, oh, I'm sorry for you because you have cancer. But then they go, ooh, I'm really sorry for you because it involves that area very, very distinctly and very directly. So yes,
Mm-hmm.
yes, I like to speak out on that for sure.
I'm so happy about that. Thank you for
Hmm.
all that you do. Now, I had noted in one of our conversations you were talking about immunotherapy.
Hmm.
What kind of immunotherapy was that you had mentioned? I can't remember the name now. I noted it down in my other notebook.
Yeah.
And you said you're rounding up now. Could you walk us
Hmm.
down that experience, immunotherapy experience, please, for our
Hmm.
audience?
Yeah, that's actually a very difficult area. And it's even after all this time, like I said, 2 years, and I'm in a 3-year course. So try to look at it as a timeline, of course, of 3 years of BCG immunotherapy. What does immunotherapy do? Immunotherapy uses our immune system to battle cancer. It's very simple.
Hmm. Hmm.
Chemotherapy uses chemicals to battle the cancer directly. So let's look at it in a very general way. So BCG, let me see if I can pronounce it correctly, because this is a very interesting area. I didn't know what it was. My doctor said it. I said, what is BCG? Bacillus Calumet Guerin is what it's called. Okay, essentially probably the people's names that founded it. It is a bovine tuberculosis vaccine. Very interesting. People don't know
Wow.
this. This is another misconception. They make it. I have a friend, Liz. She says it's made out of potatoes. You know how they do
Oh,
vaccines? These
wow.
white jacket, very
Yes.
smart people that make me survive, potatoes and bovine tuberculosis. So they take this and it's intravesical. Intravesical meaning that I always try to say the one way that you can get to the bladder that's actually very easy and convenient, just to put it tactfully. I get a catheter. I call them conscious catheters. My nurse Jenny is a very, very amazing person, but we're very, very personal when it comes to the stigma on this particular problem. Yeah, I had to get used to that. And when you're battling cancer, it's strange what you can get used to. So they put this liquid into my bladder, and I got to hold it. They pull it out. They say go home. Jenny's like, hey, have a nice week. I have, let's say, 3 years. So you get six induction doses every week. One, two, three, four, five, six, and then you get maintenance doses for the rest of the time, 3 weeks at a time. So I'll go in, they'll give it to me. Jenny will give it to me. I'll leave. I have to hold it in. I have about a 15-minute drive home. So I come home and I have to turn. I lay, if you think about it, physics,
Yeah,
it's just
so
it
that
does a
it can
coat.
go round.
Absolutely, yeah. Some of it makes common sense, and
Hmm.
there's weird misconceptions about that. People say, "Oh, that's a myth," but I do it. It seems like it makes sense. You do that, and then within about an hour, you're starting to get a bit of an immune reaction, just like the springtime. I get itchy, nose and stuffy, my eyes
Hmm.
get watery, and then by hour six, now I'm urinating blood. I'm urinating tissue. I'm very ill. That's the best way I can put it. I'm urinating, frequent urination every 15 minutes for approximately 24 hours.
Wow.
Significantly difficult. And when you do it, you're curing cancer. I went back to my doctor and I said, "Sir, I know people that have quit and it's bad." He's like, "You can quit." He's like, "That's all I'll do for you." He's a purist. BCG
Hmm.
is effective 92%. It's the reason why I sit here today, possibly. So when he said that, I was like, yes, sir, you're right. I'm not going to stop. I got 1 year left. I got six treatments left, 6 weeks in 2026, and I'm done. I saw the bell. I saw the bell, and I'm about to cry looking at it.
I
Did I
know.
really? Did I make this journey?
Yes, you did. Yes, you did. God bless your heart. One year left. I mean, that's nothing. You've been through the worst parts, you
Let's
know.
go. Let's go.
Yeah, let's go. I'm rooting for you, and I know you're gonna finish it. I know you're
Thank
gonna
you.
finish
Thank
it,
you. That means everything.
and no coming back.
No.
It's gone forever. No
Mm-mm.
coming back.
No, no, I will fight it forever and I will pay it forward.
But
Very
you're a
important.
fighter. Look at
Oh,
your pictures before, look at your picture now.
telling
I
me,
mean, look at that, your weight loss, you and your wife.
Mhm,
I mean,
mhm,
both of you
mhm,
are fighters.
mhm,
So with a
mhm.
fighter by your side as your partner and your wife and spouse,
So lucky.
those are your cheerleaders for real. And, we
Yeah,
are secondary, but
yeah,
we love
yeah.
you.
Oh, she just does it. She's like, as long as we can. She's been my main motivator. She gets up in the
Bless.
morning and she's like, so we going hiking? What are we doing?
Mm-hmm.
Well, the last time I talked to you, I was in my travel trailer. We lived at a state park. That's what we did all
Oh,
summer.
wow. That's
Yeah.
nice. I
Now I'm
love
back in
that.
Dayton, yeah, my house, and she's like, "What are we gonna do today?" So I actually, Grace, getting close to 50. I'm starting to 40 or whatever, and I was young, and now they're starting to happen. Then I get cancer, and I used to weigh 300, over 300 pounds. I get healthy. Lately,
Story.
I developed post-diabetes symptoms. Lately, I've been dealing with those now, like diabetic retinopathy. I've gone
Hmm.
30 to 50% blind in my right eye, to the
Oh
fact
my
where
goodness.
it's getting serious. My eye doctor sent me to an ophthalmologist, and he's like, you could go blind. So it doesn't
Mm.
stop.
Are you
I
going to have
wish,
surgery?
I don't
What is
know.
going to happen? So,
I don't know.
yeah, because aside diabetes, those are one of the side effects of cancer treatments.
Okay, okay,
That's
well,
why
maybe
doctors
so.
always say make sure that if you have any changes, like my PCP said so. I wear glasses. You
Yeah,
understand? I have for sight. I've always
yeah,
been myopic, but
yeah, yeah.
right from when I was in school. But my
Hmm.
doctor always insisted that just in case there are any, changes in your vision, make sure to come to me so I can refer you to an ophthalmologist because
Hmm.
this
Hmm.
happens.
I'm going
Those
in a month.
treatments are tough and they affect every part of our being, you
It's
know.
like the ophthalmologist, the last time I got them check this, because I can see now. It fills
Yeah.
with blood a little and then it'll dissipate. But my eye doctor was horrified and freaked me out. And now I have PTSD. It's really interesting. It becomes so three-dimensional. I went to, I got cancer. I'm going to the gym, everything's going great. I'm feeling great. And then I'm like, hey man, I have this diabetic retinopathy. And then it becomes emergent again. And now all of a
Hmm.
sudden, and I cried in the doctor's office because I was like, do I have eye cancer? I mean, what's happening with me right now? And now I'm thrust back into the beginning of cancer and grace. Those were the parts that I hated the most. I will gladly go through them again, and I'll carry the world,
Yeah.
and I'll carry everybody through it, just like you. You
No,
got the
don't
same,
don't don't worry. You're not having any eye
you
cancer or
know.
whatever. It's just the
I
side effects. It's just the
I
side
thank you,
effects.
Grace. Talking to people like you, and
It's just
thank
the
you.
side effects. Don't even wish that. Don't even mention it,
No,
you
I don't
know.
want to. I don't want to. Thank you.
As my mother used to say, our tongue carries
Mhm.
weight. So we have to be careful about what we
Yes,
say and what we wish.
agreed, agreed,
Yeah.
agreed, agreed.
So, I wanted to ask, so we've spoken about immunotherapy and everything. You have a year to go.
1 year, 1 year.
For anyone that, is in your position and that wants to go into a clinical trial.
Hmm.
Um, as you know, I'm a voice of cancer research for the
Hmm.
American Cancer Society. Clinical trials is my turf. I'm open to that. Um, what advice, because you're going through immunotherapy now, what advice would you give to that person has been who has been suggested to try a clinical trial, for example? What would you
Hmm.
say to them? Because a lot of people are scared.
Hmm.
People like me too, from colored, black,
Hmm.
do not have the
Hmm.
same access or do not have the same information to
Yes.
be able to go for these trials or participate or whatever. Those are two sides to my question. What would you
Hmm.
say to the person that has an opportunity to have a clinical trial? And
Yeah.
then two, how would you push for people like us to enter or to search for clinical trials?
That is a huge rabbit hole question that is on the stage of this fight. I'm also a consultant. I fell right into that stuff. I love that you mentioned research. If you have anything you want me to read that's super boring science, I'm going to do it. We're going to
I'm
figure it
there.
out from
I will.
a grassroots thing. And I was just involved in a consultation about clinical trial efficacy. As is brought to
Oh, wow.
less deserved, yeah, this is crazy you mentioned it, less deserved communities, minority communities, clinical, and more to the point, in a room with the people that figure out these clinical trials and telling them, I specifically told them, I was like, okay, you're talking about bringing things to the public. Um, we don't trust you. Okay, you and it's not about you, it's about us and we're a community. And I showed them we need to absolutely stand together attacking the clinical question. Of course, at a grassroots base, we all need to leverage up and do the fight. Cancer leverages us up. Do the fight
Yes.
between color barriers. That's the one thing that I love, like about Healthy Voices that I just attended.
Yeah.
Every single demographic of human that was so accepting and so none of that outside world stuff that's happening right now. So then I hit a round table on clinical efficacy, and I'm like, wow, this is what I do. So Grace, you'll understand. It starts at the pharmaceutical company. But the one thing I told him, I'm like, and I said, nobody's ever going to trust you. I said, you want to know why? They're going to partially trust you. If you come out with a product that works, they're going to partially trust you.
Mm.
If you talk to them nice, they're going to partially trust you, but you don't have that human factor that me and you have right now, Grace. That look in the eye. I'm a human being.
Mm-hmm.
So, come at us correct. When it comes to color barriers, forget it. When somebody says somebody that's adversely challenged, 73-year-old in the middle of nowhere with no computer that has bladder cancer, what do you do? Well, I get my laptop, I get in my car, and I take care of it. It is the responsibility of those that can do it to pay it forward to the people that
Sorry,
possibly.
what if he doesn't have a laptop? What if he doesn't have a grandchild to operate those devices for him?
I will
I mean,
not
I've gone
sleep.
to see women at that time, say that, listen, I couldn't have a teleconference with my doctor because I don't have a phone. I don't have my grandson. I have to wait till my grandson comes,
Yeah.
So
Yeah.
it's those are the kind of, things that really we appreciate everything that they're doing, but there are still barriers and gaps that have to
A
be
community,
closed.
Grace, a community. The first thing I think of, a community front, an oversight committee that is me and you in the front
Mm-hmm.
saying, hey, you are accountable for what you do to
Mm-hmm.
our community, their
Mm-hmm.
community, our
Yes.
community. They're making the medication. Now, on the flip side of clinical trials, let's say,
Mm-hmm.
let's take First thing I thought is like, okay, I got BCG. It's 92% effective. My doctor thinks on no other fronts. He won't put me on anything else, not even chemo. He just sent me out the door. Now, there are other medications that work. So I say, I actually promo a medication now that's just delayed release gemcitabine. And it's called Inlexo. It's just for people that are BCG unresponsive. So they
Hmm.
actually have a chance. So if somebody came to me and I had bladder cancer and they said, all right, Dan, you can do BCG, which has 92% efficacy. I've got it here, right over here in the cabinet. Or you can do this clinical trial. And my first thought was, am I going to get a placebo? Don't even
Yes.
talk about anything else until you convince people that there's not a placebo in
Hmm.
cancer clinical trials. And when I thought
Hmm.
about it, I'm like, well, that would really be terribly harsh and indelicate if people, well, you might go to placebo, so you guys are going to die of cancer. We're going to make sure we mark you down, but the other ones are going to get lucky. No, that's why there needs to be oversight. That's why there needs to be pragmatism and human emotion and empathy that very much align with this or unorganized and very much money-driven system. And I
Hmm.
am with anyone who wants to
Yeah.
fix that, who wants to remedy that. Yeah.
Oh wow, that's fantastic. I'm so happy that we're on the same page because
Yeah.
like you mentioned, a lot of people try to sweep that under the carpet
Hmm.
without bringing out these very crucial issues, that
Hmm.
really when it rains on my roof, it will rain on yours. If it doesn't affect you now, it'll affect you down the road. So these are issues that have to be tackled or
Yeah.
seen to be tackled so that you were talking about trust, so that trust is, in the matrix. Because
Hmm.
if the patients, if the community don't trust you, there's nothing you can do to get that trust back, huh? Never.
And then you're going to have parts of the community that are underserved. So these
Yes,
very circular things that are very
yes.
pragmatically
And
taken care
and
of.
and when they're not underserved, what happens? They
Mhm.
die because they will not have access to all those things, screenings,
Mhm.
pap
Mhm.
smear tests, colonoscopies,
Mobile
things that,
ones
yes,
that go to communities that like bladder cancer
exactly.
tests, and the box tests, they're getting very popular.
Hmm.
Just like there's a bladder cancer test for home, and then just like Cologuard and things like that, people go, oh well, there you get false positives. Well, I don't care. It'll get you to the doctor so
Yes,
you can get further checks. So people got to
exactly.
change the stereotypes, and that's what me and you are here for, Grace. Some people are a little bit
Absolutely.
more of a loudspeaker, and
Yes,
that's why I like
absolutely
doing it.
true. Thank you so much, Danny. So, there was something else. There was the name of a drug you had mentioned, link something. I'm trying to look for it here. Um,
Trying to remember, and Lexo would be the
I think it
one.
was was it Inlexo or
That was it.
Elexo?
INLE
Inlexo.
INLEXZO. It's
Inlexo. Let me just
yeah, yeah.
write that down. Inlexo.
Yeah,
Yes.
I actively promote for Inlexo
Okay.
and for J&J Pharmaceuticals. I have been for a while since before it left the FDA. And what it is, when you think about our past conversation, and I can give you whatever materials you'd like on it. I do social media on it all the time. Like I said, BCG is 92% effective, but there's a
Mm-hmm.
possibility that you won't respond to BCG unresponsiveness, which means it's not gonna cure your cancer.
Mm-hmm.
So the only real viable go-to on that is chemotherapy. So they'll immediately go to chemo washes in the bladder. Intravesical, same thing, just intravesical chemo washes. Like I said, immune versus direct contact with chemo. So Johnson and Johnson figured out that time release gemcitabine is a chemo drug that it's kind of a universal chemo. It comes in a pretzel. They straighten it out with some piece of plastic, science, and they get it in intravesically. And when it recoils, it turns into a pretzel. Well, it's got osmotic plugs in it, and they just time release. It's just
Bit
it
by
just
bit.
so what it stands in the way of is some. Remember, I said I urinate blood, I
Mm-hmm.
urinate tissue. These things are not as common. The month long that I'm sick, so the only drawback on that is it's 82.6 effective versus 92. So when we know a little bit about statistics, the difference between 82 and 92 aren't really good. 10% statistically, we're just going to probably deal with that. If you're BCG unresponsive, this is more, you're going to probably get another tumor. Bladder tumors are very recurrent. So you want to get the
Yes.
surgery, get them in there, get them gone. Chemo, BCG, let's get it to work. It's a very fast-paced process. So
Mm-hmm.
really, when it comes right down to it, The Inlexo just got approved by the FDA. It's a system versus a new drug, and it's the most effective thing out there right now.
Okay. Oh, wow. I have to read up. Maybe you'll
Yeah,
send me that
I
material.
will. I
Please,
absolutely will.
please do so I can, familiarize myself with it.
Oh
You
yeah, it's
know,
great. It's great. It's saving
all
people.
cancers matter on this platform.
Yeah, just throw it,
And
take the arsenal and throw it at it. Be safe. No, we were just talking about oversight committees, so we got to make
mhm.
sure they're not going to poison us. And
Yeah,
and now I'm telling you, on
I
a
know.
community level, as I sit here and promote it, I also promote safe and effective things for our community. We don't want things that cause cancer. What is the
Mm-hmm.
plastic they use? Hey guys, come on, you got to be accountable. So I'll
Mm-hmm.
start that oversight here. That's well within my rights.
Absolutely. Absolutely. Freedom of speech.
Heck
Yes,
yeah, and it's good. Right now, hey, they're passing with flying colors. The people that make it are great, great friends. So.
absolutely. So it's been so wonderful talking to you, Danny. Honestly, we could go on and on. I want to know what you would say to that person that has been newly diagnosed with any cancer. What would
Mhm.
you say to them now?
Yeah, you're going to be thrust into a void and you are going to be alone. And just know that in that void are a whole bunch of people that really love you. And once you figure out you can connect with them, you're going to be better for it. You know what I mean? So just do that and I'll be there waiting on you. And I'll actually be bothering you every once in a while to let you know we're still here. So just
Oh, that's
that's it.
wonderful.
Community, love.
Mm-hmm. Absolutely. And so, what's one fun thing about you? Besides hiking and staying in your,
Yeah, yeah.
van and all that and having fun, I
I
want
when
something about you.
yeah,
I know
something
maybe
fun.
music.
Yeah, that's gonna be it,
I'm a
actually.
music person myself
I
because I
love
saw you
music. Yeah.
jamming, that
Yeah,
was
yeah.
so
When it's
wonderful.
fun, I always got my guitar right there within arm's reach.
Mm-hmm.
I will say that, without getting too in depth about it, I've played guitar for a really long time. I've taught many people how to play guitar. There's such joy. I've
Oh,
seen
lovely.
cancer patients brighten up and with
Mm-hmm.
one chord, and they just go, "Oh my goodness, that's the best thing ever." So, to integrate music with my message, it's enough to public speak, but it's much more effective to give something to them. And everybody has music. The universal language. Music is the same right
Oh,
here
yes.
as it is across the universe.
I don't think I
So.
could have survived without music. I
No,
don't think
play.
so.
Get a get a
I'm a
get a
jazz
cancer.
person.
Oh
Oh,
gosh,
yeah.
everything. Every
Everything.
genre has a good song, but every
Yeah.
genre has a bad song. So I always
Exactly.
no, but yeah, that's just the thing. If you whether you have ears or not, whether you tap on this desk, somebody in another universe might will probably understand it. So there's
Hmm.
healing in that, and yeah, that's the fun. I can let it go, and it saved my life. Just simply
I
music.
know. Oh, wow, Danny. Thank you so much for coming. We have to end here, but definitely we'll be having several conversations in the
Yes,
future.
yes,
God
yes.
bless you and
God bless
yours.
you. You're a great friend, Grace. You're
You're
amazing. Thank you.
wonderful. Thank you so much. And
You're
please
welcome.
continue to support Cancer Convos with Grace B.